All right, looks like everyone is in the webinar, so we're going to go ahead and begin. My name is Stephen Walters. I'm with Asset Preservation Solutions. We just celebrated our 17-year anniversary, and I am the COO as well as an insurance agent for the company. So most people, when they get started down the Medicare path, kind of see it as a maze. They get littered with mail. Everyone has the best plan, and everyone wants you to sign up with them somewhere between October and January. So after this webinar, the goal is for you to be able to throw away all that mail and make a decision that you have confidence in. Here are some of the words that you see with Medicare. You got Part D, Part B, Part C, Part A. You've got inflation on plans. People think it's political. You have the Center for Medicaid and Medicare Services. So we're going to unpack a lot of this in this presentation. Asset Preservation Solutions is part of the Council of Financial Educators. It is a 501c3, and all we do is try to educate people to make better financial choices. Every good webinar has a disclaimer, so here is one. This webinar is for educational purposes only, and no plan-specific benefits or details will be shared. I am also not connected with the federal Medicare program. So when you sign up for Medicare, you're going to get this book. It's about 200 pages, and it's Medicare and You. Once you sign up for Part A and B, or just one of them, you'll receive your Medicare health insurance card. Here's an example of one down here in the bottom right. So let's figure out what the difference is between Medicare and Medicaid. Medicare is an entitlement program. Anyone over the age of 65 qualifies for Medicare. People under the age of 65 with certain disabilities also qualify. Anyone with end-stage renal disease, they're also going to qualify for Medicare. Medicaid, on the other hand, is a joint state and federal program that pays for medical costs for those with limited income and resources. A person qualified for both Medicare and Medicaid is called dual eligible. These government programs are administered by CMS, or the Center for Medicare and Medicaid Services. So let's talk about the differences in original Medicare. Original Medicare has Part A and it has Part B. Part A is anything involving a hospital, and Part B is anything involving a doctor's office or a medical service. Pretty easy to delineate between the two. A is hospital, B is a doctor. So when we want to unpack Medicare Parts A and Part B, there's a big distinction here. You're either going to choose to be in a supplement plan of Medicare, or you're going to be in an advantage plan of Medicare. Now, the left side, you have an employer retiree group coverage, and sometimes they're going to require you to sign up for Part A and Part B. A lot of people that work for the state are going to see these kind of coverages. The other part of that is a Medicare supplement plan or Medigap. Those two words are interchangeable, and they have plans A through N, and then you can buy a Part D prescription drug plan separately with that. We'll go further into the Part D plan in just a little bit. The other side of this coin is a Medicare Advantage plan. These have HMOs, PPS, MSA, so you're a part of a network with those. Sometimes the prescription drug plan is included. Sometimes it's a standalone that you have to purchase separately. The other plan that you have available is the Medicaid and Medicare Advantage plan. So this is typically a Medicaid plan that is a Medicaid Advantage plan. So when we boil this down, typically your normal average consumer is going to have this choice. We're going to have a Medicare supplement plan or a Medicare Advantage plan. Now, remember, a Medicare supplement plan, you do not have to be in a network. You simply have to ask the doctor or the hospital, do you take Medicare insurance? If they answer yes, then you can use your insurance there. If it's a Medicare Advantage plan, you're going to have to find a network or a doctor's office that's within your network. So let's unpack Part A. Part A, if you remember, is the hospital insurance. There's no premiums due for most people. The way you qualify for no premiums is you have a minimum of 40 quarters of Medicare taxes paid or 10 years of work where you're paying Medicare taxes. Eligibility prior to age 65 for some people would be a disability or end-stage renal disease. So the people that will pay a premium are people that worked for less than 10 years, and there is a citizenship requirement to qualify for Medicare Part A, even with a premium. So let's talk about what it covers now that you know if you're qualified or not. Medicare Part A covers a semi-private room in a hospital, meals, general nursing, hospital services, supplies, and all but the first 3 pints of blood. So Medicare Part A is not going to cover you to have, you know, a plasma screen TV or HBO or, you know, filet mignon brought to the room. It will cover inpatient mental health care coverage for 190 days over your lifetime. So some of these time periods that they give you, like 190 days, can be recycled over the course of a year. Well, this one is for your lifetime. So 190 days of your lifetime, you could go 30 days at age 66, then have to go back into an inpatient mental health care when you're 75. They're only going to cover 190 days of your whole lifetime. Coverage is up to 90 days, and then an additional 60 days are a lifetime reserve, which can be used for up to 150 days. But once the 60 days are used, they are no longer available. So this is the same thing. They're going to give you coverage for up to 90 days in one admittance to the hospital, and then you have an extra reserve bank of 60 days that you can use over your lifetime. What Medicare excludes is private duty nursing, comfort, and convenience items like HBO or a flat screen TV, something to that extent. But there's gaps in Medicare. So if you're in the hospital days 1 through 60, you're required to pay $13.16. After you get over the 60-day mark, you're at 61 to 90 days, you're required to pay $329 a day that you are in the hospital. Then once you get to over 90 days in a hospital, 91 through 150, you're required to pay $658 a day. And remember, all charges for the first 3 pints of blood are on you. So this is a bring your own blood program. All costs beyond 150 days are on you. And any comfort and convenience items fall on you as well. So here is how Medicare handles skilled nursing facility care coinsurance. So days 0 through 20, that is paid completely by Medicare. Days 21 through 100 are going to be paid jointly by you and Medicare, and you're responsible for $164.50 a day. After this, you are solely responsible for any of your long-term care needs. And a lot of people think that Medicare is just going to pay for your long-term care if you need it. Well, that's kind of a misnomer in a way. Yes, they do pay for you for 20 days and then help you out days 21 through 100, but they're not completely going to foot that bill for you. So let's talk about Part B. Part B is your medical insurance when you're going to doctor's office, specialists, so on and so forth. So premiums are deducted from your Social Security check for most people. Now, if you're on Part B and you're delaying your Social Security, this is something where you'll have to write a check, send it in for your Part B. The state Medicaid program, the state will pay the premium for those who meet income and asset guidelines. So how do you enroll? Well, first off, Part B is optional. And they give you this option because sometimes people don't want to have medical insurance through Medicare. They can get it in other places, but if you're signing up for Medicare supplement, typically you're going to need Part B. There is a fee if you do not sign up for Part B when you can first get it. And it is 10% of the premium for each 12-month period that you do not sign up for Part B. So let's say you turn 65, you sign up for Part A, you say, I don't think I need Part B, and you wait 2 years down the road to sign up for Part B and decide, you know what, I need it. If you do that, your premium for Part B is going to be 20% higher than what the original cost would be, and that fine stays with you for life. So if you wait 5 years, it's 50% higher. If you wait 7, it's 70% higher, and this fee never goes away. It sticks with you for life. So your initial enrollment period, or your IEP, is 7 months. The time that you can sign up for Part B and Part A is 3 months before your birthday, the date of your birth, and then 3 months after your birthday. The general enrollment period for Part B is January 1st through March 31st of each year, and then the coverage becomes effective on July 1st. Annual deductible for Part B is $183. And Part B works on a co-insurance program of 80-20. So Medicare pays 80%, you pay 20% of anything that is a Medicare approved medical expense. So here's an example of a calendar. Let's say that your birthday is in April and you have the ability to sign up as early as January 1st and all the way through July into the month. So let's talk about Part D. There's two types. That Part D is your prescription drug plan. There's a standalone one that you can get that is typically associated with Medicare supplement. And then there's a MAPD, which is a prescription drug plan that is simply integrated into your Medicare Advantage plan. Now, not all Medicare Advantage plans have one. Sometimes you need to get a standalone, but most do. So who is eligible for Medicare Part D? Anyone who is entitled to Medicare Part A and or is enrolled in Part B qualifies for Part D. They have to permanently reside in a service area. Also, people who qualify for Medicare and Medicaid, those dual eligible people, they qualify for Part D. Higher premium for people who wait, except for those with other coverage at least as good as Medicare prescription drug coverage. So this has the same fee or penalty that's associated with Part B. The 10% penalty, if you wait 5 years to sign up for Part D, then you're going to have a 50% penalty associated with that premium. So let's get into Medicare supplement insurance. There are 57 carriers with the exact same plans in the Carolinas right now. And this is a very important thing to know and take note of. So when I say the exact same plan, I mean that if you are going to get Plan A Medicare supplement, every single insurance carrier is going to cover the exact same thing for Plan A. If you get Plan F, it's the same coverage every single carrier for Plan F. Plan N, Plan C, all of them are going to have the exact same coverage. The only difference is that it's a different insurance company that you have the plan with. So For Medicare Supplement, they're offered by insurance companies under strict guidelines. All the Medicare Supplement plans are identical in medical benefits, just like I said. And Plan F coverage is offered by any of the 47 Medigap carriers in the United States, and it's all the exact same. So let's break this down a little bit and talk about different Medicare Supplement plans. I call this the periodic table of Medicare Supplement. It's my fun little term I coined for it. But there's a problem with this plan to me, and that is that we just talked about Medicare Part A, Part B, and Part D. Well, now we're talking about Medigap or Medicare Supplement plans, and they have some of the same letters. So when we're looking at Medigap Plan A, it is not Medicare Part A. There's a difference there. Just make sure that you know there is a difference. So when we look at what Medicare Supplement can cover for you, you see that every single plan here can cover your basic benefits, including 100% of your Part B coinsurance. So that Part B that we were talking about, there's a coinsurance of 80%, Medicare covers 20%, you're responsible for. Every single plan is going to cover that Part B coinsurance. Now, if we start looking at this, notice that Plan F and Plan G are very similar. There is only one box that is redded out for Plan G versus Plan F. And when you're getting letters in the mail and you're seeing ads on TV, most people are advertising Plan F. So if we look at what it covers your Part B coinsurance. It covers any skilled nursing coinsurance. So remember, days 1 through 20, Medicare is covering your skilled nursing days 21 through 100. They're picking up that little bit that you need to cover. They cover the Part A deductible. Plan G does not cover the Part B deductible. Now, the Part B deductible is $183 annually. So let's just keep note of that. The Medicare Part B excess charge they cover in full, and any foreign travel emergency they're going to cover. And how Medicare sees foreign travel emergencies, let's say you break your arm and you're on a trip in Spain. You will have to pay in Spain the cost for that broken arm, any surgery you're going to have. And then you're going to submit that bill to Medicare, and they will reimburse you for the services that they can reimburse you for. So the big thing here is, here's what all these plans are going to cover for you. But I like to highlight Plan F and Plan G. They're usually typically the plans that are most bought. And the only difference there is the Medicare Part B deductible. And we know that deductible is $183 a year. So let's talk about Medicare Advantage. Medicare Advantage has, in North and South Carolina, there's 16 carriers and 41 plans. We're just going to do a compare and contrast of Supplement versus Advantage here. So with Medicare Supplement, you can have any doctor or hospital in the USA. You don't have to be in a network. All you have to do, like I said before, is ask if they take Medicare insurance. If they do, you're good to go. Medicare Advantage, the HMO is going to require a network. Your PPO is not. But a lot of the Medicare Advantage plans, you're going to require network to see anybody. Medicare Supplement, if we're going with Plan F, there are no copays. If we go with Plan G, you have your Part B deductible that you're going to have to get over. But after that, there won't be another copay for you. Most Medicare Advantage plans are going to have copays and shared expenses. For Medicare Supplement, if we're going with Plan F, we're going to have no deductible. Medicare Advantage, no deductible. No plan currently has a deductible. With Medicare Supplement, you have no out-of-pocket costs. Every single place that Medicare Part A and Part B had a shortfall, your Medicare supplement Part F is going to pick that up for you. With Medicare Advantage, there are out-of-pocket expenses. They vary by plan, and it's a shared expense plan. Now, with Medicare Supplement, you must add a prescription drug plan if you choose to ever have one. With Medicare Advantage, sometimes they are included. Usually it is, sometimes it's not. Just depends on the plan. The most popular reason for the plan being selected for Medicare Supplement is you can use any doctor in the US. There's no copays, there's no referrals. You just have a freedom of choice with Medicare Supplement. Medicare Advantage, the most popular reason this plan is selected is there's low to no premiums. Doctors and hospitals are on network, so if you like your network, it's a great fit for you. There's a prescription benefit that's usually included, that Part D piece that you need, and it is has a better simplicity of use. You're getting everything in one hub, so it makes it easier for you to keep track of everything typically. So let's talk about cost a little bit. Medicare Supplement, Medicare Advantage, you don't have to pay for Part A. That's an entitlement program. Congratulations. Medicare Part B, you're going to have $144 a month that you're going to be responsible for. Most of the time, this is coming out of your Social Security check. Medigap Plan F. Typically, what we see for Plan F in my service area of Greensboro, where I live, typical plan is anywhere between $130 at the low end, and I've seen them as high as $300 on the high end. Medicare Advantage, there's many different plans. A lot offer low to no premium. I've seen them for $60 a month. I've also seen them for $100 a month. Just depends on which coverage you choose. So Medicare Part D, that price varies for everyone. I've seen them as low as about $12 a month. I've seen them as high as $35 a month. It really just depends on the tier of drug you're on, what drugs you're using, and your age, your income, and your gender. And that's about it. So what's your monthly cost? It's hard to say, but I'm going to say if we do $144 for your Medicare Part B, if you go with Plan F on the low side, you're talking about another $130, and then tack on about another 15 to 20 bucks for your Medicare Part D. So we're looking at right around $300 to $310 for that. You're going to have prescription copays for Medicare Supplement. Now with Medicare Advantage, you're going to have maybe a low to no premium on your Advantage premium. So we know you're going to have $144 that you're going to be responsible for. The Advantage and the Part D usually comes together. We're going to say it's a zero. So it would be about $144 a month for your coverage. But also remember that you're going to have to add your doctor copay, your hospital copay, and your prescription copays in there. So you do have some things tacked on if you do need service. But if you're a healthy individual and you don't go to the doctor much, you don't have a need for the hospital, then this can be a cheaper option for you. So let's talk about election periods. You can enroll in Medicare Advantage and your prescription drug plans only during valid election periods. Now you have your initial election period. That's your IEP. That's when you're going to stage into Medicare. It is important to note for your IEP that there is no medical underwriting history that comes along with you. And it is just for this 7-month period that this is allowed. If you're going to change plans later on down the road, let's say 5 years from now, you've decided I want to switch to an Advantage plan, or I want to switch to a different supplement plan, then your medical underwriting history is going to come with you. The other period is your annual election period or open enrollment period. This is when people are getting on the phones, calling you, sending you letters, trying to get you to talk to them. This is October 15th through December 7th, and the effective date for all the coverage is January 1st. Now, if you begin to need medications, and you were on a Part D plan where you didn't really have any medications, the annual election period or the open enrollment period is the time where you can reevaluate which drug plan you would like to be on. This gives you time and freedom to look at the different plans and what drugs your tier or what tiers your drugs fall in. So if you didn't have any drugs or prescriptions that you needed the last year and now you're, let's say, on a tier 3 drug, then reevaluating your prescription drug plan to make sure that that medication falls within your plan is very important and needs to be done in this time period. The last period is your special election period. So anytime that you move from an area or lose coverage, you are being given a special election period. All Medicare supplement and advantage plans, the cost is driven by your age, your sex, and your location. So in order to reevaluate what you're going to need to pay for your insurance and what insurance you can get, you're given this special election period anytime you move from an area or you lose coverage. So when should you enroll in Medicare? You can enroll in Medicare if you're still working and you're covered under your employee group insurance, but let's talk about it. If you're still working and you're covered under your group employee insurance, stay with them. Delay enrollment in Medicare, you don't have a penalty or no loss of options. The other choice there is to leave your group insurance, enroll in Medicare, and select either a Medigap or a Medicare Advantage plan. Now, sometimes, not all the time, but sometimes, Medicare is actually a cheaper option for you than your group employee coverage. And when I say that, if you don't have any dependents on your plan, if your spouse is not on your plan, then this could be an option for you. If you have dependents on your plan, your best bet typically is to stay with your employee group coverage. So what if you're collecting Social Security? Then enrollment in Medicare Part A and Part B is usually automatic. You're going to choose between a retiree or employee group insurance plan that has credible coverage, or you're going to delay enrollment in Medicare Part B. The other side of that is you're going to select a Medigap or a Medicare Advantage plan after you've enrolled in Medicare Part A and Part B. So what if you are not collecting Social Security? You can call Social Security to schedule an appointment to enroll in Medicare, and you can do this, remember, in your initial election period 90 days before your birth month. So you're going to sign up for Part B and Part A through the Social Security office. You can get an entitlement document to prove effective dates and Medicare claim number with the letter. You can ask for a print of their screen. If you're going physically down to the Social Security office, ask for a print of their screen. I trust people, but sometimes you just need proof if anything is ever contested. And then you can select retiree group insurance or Medigap or Medicare Advantage coverage. So some of the websites that we want you to go to are Medicare.gov, MySocialSecurity.gov. This is the site to sign up for Part A, Part B. And then there's MyMedicare.gov, and that's where you can see your claim number. You can see your effective dates for Medicare and other information for Medicare. And that is it. If you have any questions, please do not hesitate to reach out to Wesley and I. Our website is assetpreservation.net. You can also email me with any questions at steven@assetpreservation.net. That is STEPHEN@assetpreservation.net. Thanks for joining the webinar, and I hope you have a great day.